My name is Parth Borker, and welcome to the second episode of the BCA Health Policy Conference. As discussed in the previous episode of this podcast, the opioid crisis is a big issue in today's society. Dr. Holden and Mr. Barrett explain the negative impact of opioids on the general public. Today we will be discussing how to stop an opioid overdose using Narcan, information which can be used to save someone's life. Dr. Neil Jain has agreed to speak on the importance of Narcan. Dr. Jain is a resident physician at Georgetown University and is completing his integrated interventional radiology residency at the hospital. He graduated from Boston University receiving his BS in human physiology and BA in psychology, and is currently developing national policies with the American Medical Association to combat the opioid crisis. He was inducted into the prestigious Gold Humanism Honor Society and given the Excellence in Leadership Award for his dedication to medicine and service. So the first question I want to ask you, Dr. Jain, is when should someone be given Narcan?
Hey, thanks again, Parth, for having me. I think what you and your team is doing is fantastic. The opioid crisis is real and it's unforgiving. So again, I applaud you guys for bringing this issue to your community and your peers. So I want to just start that off before we kind of dive deep into Narcan and opioid crisis. So what is Narcan and when do you give Narcan? So Narcan is a rescue drug for the opioid crisis. Narcan is the brand name for naloxone, which is the generic name which many people often interchangeably use. So naloxone should be given to any person or individuals who show any signs of an opioid overdose or when an overdose is suspected. And it becomes tricky if you don't know what the signs are. And these signs of an opioid overdose often mimic respiratory depression. So what is this exactly? We learn in medical school throughout our entire training on how to notice an opioid overdose. Usually when an individual has an overdose, they have trouble breathing, they may have blue or cyanotic fingers and toes, right? That's because oxygen isn't going to their fingers, right, to the capillary beds of their fingers and toes, and they're usually the first to go. And you have respiratory depression that that their primary reason for this overdose is that they can't breathe. So how do you check? If you see an unconscious man, what's the first thing you should do? You should first call out his or her name. Usually people with Narcan, they'll start, with someone who has an opioid crisis, will first start mumbling. You immediately at that instance see if you can take any vitals. And again, this is hard to do in the community when you don't have access to, let's say, a pulse oximeter. But this is something, you see how their oxygen is, how their oxygen saturation is, and you try to develop a diagnosis of what's exactly going on. Where this comes into play for most of us and our community is for a suspected area or a suspected population in a community that you may already know that may be more prone to an opioid overdose. So at this point, if you suspect an opioid overdose, you give naloxone. You see respiratory depression, cyanotic fingers, you call out their name and they're not answering, but you know they have a pulse. Usually calling out their name isn't always the most efficient. You try to rub their sternum really aggressively, saying, "Hey, sir, can you hear me?" Right? You rub their sternum to a point that it actually is slightly painful but not damaging, just to make sure that they're conscious. And at this point, if you suspect an overdose, usually they may have needle marks in their hand or in their elbow joint. You look for needle marks. You kind of make a quick assessment of what exactly is going on. And if you suspect an overdose of any type of opioids, you administer Narcan.
So, what are some symptoms of an overdose, or like some common symptoms of an opioid overdose that you can that anybody can recognize and be able to give Narcan?
Great question. I believe that the first step to recognizing, or first step of rescuing someone, is actually recognizing an overdose. So some common symptoms that individuals will have are slowed breathing, or absolutely no breathing at all, but they'll still have a pulse. They may have slow heartbeats. Often you see very small or pinpoint pupils in their eyes. So that's one of the first signs to always look for. No breathing, look into their eyes. Some people experience extreme drowsiness, while others are just completely unable to be awoken from sleep. Some may have cyanotic fingers, which also means that their fingertips may be blue. That's not always the case, so I wouldn't rely on it, but it can happen. But those are the major ones to always look out for before administering naloxone.
So now that we know when to give Narcan, what are some contraindications for Narcan? When should we not give it?
Great question. So there's a couple contraindications to look out for. Narcan actually comes in two different forms, IV and intranasal form. If we're worried about any facial trauma, right? Any type of injury to the nose or the airway, giving intranasal Narcan won't be effective. So that's the first thing you have to look for, is which way can I give Narcan? So, because it may be just contraindicated or ineffective to go intranasally if they already have a damaged airway. Second, cardiac disease. So naloxone should always be used in caution with patients with cardiac disease or in patients receiving any type of cardioactive drugs that can cause potential adverse cardiovascular effects such as hypotension, ventricular tachycardia, fibrillation, pulmonary edema. All these are, again, severe cardiovascular diseases, and yes, they are contraindications, but this is something that if you don't know a patient's history, that you most likely cannot find out, right? If they're unconscious and if you don't know their personal history or they don't have any bystanders during an opioid crisis that can describe their personal history, this will be really hard to kind of gather. So in this case, it's just something that you need to look out for and just take caution to. I know there has been some talks about pregnancy and breastfeeding being contraindications. Just want to put it out there that there's only limited available data on both of these, so they aren't something that you should actually rely on. I completely believe that regardless if you're pregnant or breastfeeding, unless there's other medical problems that the doctor or the physician has mentioned, that giving life-saving treatment should not be withheld.
So, how does Narcan work to subside the effects of an overdose? Like, what does it do to the body?
Sure. So you have these receptors in your on your cells, right? Not to go too much into the physiology of it, but it's a non-selective and a competitive opioid receptor antagonist. And what it does is these opioids, such as heroin and morphine and codeine, they latch onto these receptors, these mu opioid receptors that give you that high. What naloxone does is it replaces these or kicks off these opioid molecules and reverses the effects of the opioids. So, for example, the depression of the central nervous system and the respiratory system can be completely reversed by inducing or implementing Narcan during an opioid overdose.
So since we know that Narcan and naloxone does treat the side effects of an opioid overdose, and since most opioid overdoses occur at a home setting, what modifications have been made to the process of administering naloxone that have made this process simpler to the public?
Great question. So in this case, intranasal is often the best way to go, and there's often instructions on the box on exactly how to use it. So I think this is a great time to actually talk about how do you administer naloxone. So you always start off with what we had discussed earlier, trying to see and awake the patient, right? You really want this patient to be awake and responsive. You call out his or her name, right? You rub the sternum. You check for cyanosis, right? You first want to diagnose clinically as much as you can that this is an opioid overdose. And that's the first step, that this isn't anything else like such as hypoglycemia or a stroke or any other medical condition. So that's the first thing you want to do. Second thing you want to do is administer a naloxone. And in this case, they made it very simple by this intranasal device. And exactly, you read the box exactly or you do exactly as the box instructs, that you put this little device that has a little nasal cannula on it, and you stick it in one nair, and you lift the chin up so so your neck is slightly hyperextended, and you administer naloxone. And you do that both on the right and the left nairs. And that's the most simplest way. And again, these instructions are easily visible and broken down to the public. IV is obviously more complicated, and it's usually for cases at the hospital and intense medical care units.
So you mentioned that there were multiple ways of giving naloxone, such as intranasally or intravenously, but are there any other ways?
These are the two primary ways, I would say. There isn't other, in such life-threatening events, there aren't more other ways that most medical professionals rely on.
So how could someone get access to this naloxone, and what types, such as like intranasally or IV, are available to the public?
Sure. So intranasally is definitely more available. In Jersey, there was this law passed about I want to say a year ago or so that made naloxone free to the public. It was actually last June when this came out, and you can grab naloxone at your local Walgreens, CVS pharmacy, and kind of carry it around with you. And this is where kind of, there's a lot of different anecdotal studies that have been done that